I had a case, that's what I was going to talk to you. I have a family, yeah, of a grandmother, a mother, and daughter. All three of them from the Papaveraceae family. Now, so when I explain this, it will answer your opium. The mother came to me. The mother is about 50 years old. The daughter is about 30. And the grandmother is in her 80s, like this. The mother came to me, and what I gave her is Chelidonium from the Papaveraceae family. Chelidonium, which is in the malaria miasm. Yeah? She has exactly the stools of Chelidonium, yellow colored, clay colored stools. Yeah? She has extreme desire for hot drinks. She has some very peculiar physical symptoms of Chelidonium. But apart from that, it was from the mother that I understood the grandmother and the daughter both. And her main thing was, she said, for me, even a pinprick is the same as labor pain. There's no difference. Pinprick. Because pain is pain. And how can you define the intensity? It's always intense. Okay? One of the things with her was that she would keep falling sick with very little things like constipation or piles or, hemorrhoids of the first degree or a cut or a wound. And she would, really come very acutely, like a little child. For a 50-year-old woman, her complaining was a bit too much. Yeah? So you see a very childlike behavior in her, which is much before psychosis. Yeah? And every time we traveled abroad, which we do twice a year or thrice a year sometimes, and she will fall sick. And then she say, you went away, there was nobody to help me, I don't like allopathy, I don't like going to the hospital. She would make this huge big complaint like a little child, why did you go away? Like this, you're not supposed to go away. And even if we told her that, okay, we start our Europe trip, we will not be there for 1 month, the next day she's bound to fall sick. An intense headache, an intense body ache, and everything is intense. So the intense and the complaining, yeah, and the physical symptoms of really desiring hot drinks and yellow colored stools, clay colored, took us to Chelidonium. She did well. Her mother, yeah, was opium. Her mother has served the father. Her father is a doctor. Her father was a doctor. He was, I think, a diabetologist or something. But he also died of diabetes. And he died of the complications, yeah. He had nephropathy, he had retinopathy, he lost his vision in the last few years of his life. And the mother was serving the father all throughout the process. When the father died, and the mother was very healthy, yeah. When the father died, she developed cancer. She developed a small tumor, okay. And so then she said, and then this woman brought the mother to us and said, okay, she's already, she was approximately 75, 76. And she said, whatever little you can do, because it was also almost last stages. Yeah. And the doctor said, there's not much that can be done. And so we were helping the mother through those last few years. And she really sailed very well with opium in a low potency, 30. But the thing that the mother told us was, I just thought when he died, now I am free of all the pain. Because I saw so much pain and I thought it was his pain, it wasn't her pain. Yeah? The father was going through all this. And the mother said, and all throughout, she was serving and serving and serving and serving. So you see this need to keep doing overtly. And she said, I was just keeping control that one day I will be able to get out of this painful life and live my own life. And she never mentioned, she appeared to be a very strong woman. And she never mentioned, that she was going through all of this. That she was feeling the pain of her husband, that she was just feeling pain to stay in that situation and not be able to enjoy her life. So I asked her, what's your feeling in this pain? And she said, actually, I am the last person to be able to take care of a man like that. Because like her daughter, she said, I can't even see a needle prick. But I kept mum and I kept my control and I kept serving him. So in a situation of pain, I don't complain. I simply keep my work going. Whereas here you saw that the control was almost slipping in the bombs. Whereas in opium, you hardly see that it's slipping. You only see, I do. And the mother said, I was doing. And she was so controlled that she probably had the cancer much before the father had all his complications. And it never came out. Till he died, and then it just blew up out of proportion. So then you see the chaos of cancer. Cancer miasm has control on one side and chaos on the other side. And you saw control till she could. But when she really could give up the control and lead her own life without pain, she ended in chaos, which is the other side of cancer. That's the difference. But what the daughter needed, there's one more point, I told you there's a 30-year-old daughter as well. She needed agrimony, how do you call it? Argimony. No, agrimone, not argimony. That's another remedy, no? Argimone. Money, or I don't know how do you call it. Which is typhoid miasm. Now, in her case, I always see her as a very nice, very sensitive, very, very pretty looking girl, having no complaints, no issues, nothing bothers her, nothing puts her up or down. It's very difficult to get a case out of this girl. And yet she would come to me with sore throats. Sore throat. Every few months. And I thought, and tonsillitis, very severe tonsillitis. So I always thought to myself, what is troubling her? If she is so sweet, she said, I have no problems at work. I have no ambitions, nothing of that sort. I'm happy doing my job. I'm happy going out on a weekend. I'm happy watching the scenery. I'm happy leading a normal life. So where was the problem? Why was she coming up with this tonsillitis again and again and again? So I asked her, what do you feel about the tonsillitis? And that's what she said. It's very painful and it stops me from having a pain-free life. So like her mother, she is also sensitive to pain. She has no other problem in her life, but she wants to avoid pain. And what happens every few months is that she ends up in a painful situation. And one thing that she told me, and I thought, okay, maybe she's like her mother. But she told me a very interesting thing. She said, I was a little child and all my teeth, milk teeth, had to be pulled out one after the other because they wouldn't come off and the permanent teeth had started to come. Imagine all 20 milk teeth to be pulled out. Not all 20, how many go off? We have to... No, 20. Milk teeth are only 20. 20, yeah. But the premolars don't go off. It's only the rest of them, molars and premolars. So, she said, so the rest of them had to be pulled out. And I said, wow, that's the worst for a Papaveraceae. So I said, how did it feel? She said, I don't remember anything. So that's the numbness. She says, all I remember is my father taking me to the clinic. And then she said, you know what I remember? is always getting an ice cream at the end of it. So my ice cream was what kept me going. And she says, but it's surprising that so many times my mother, my friends, my family keep asking me, it must have been painful. And I have no memories except the ice cream cup. So on one side she was numbing it, but also what I saw was one little ice cream cup could keep her happy, and then she forgot it. And that's why I took the typhoid miasm, that immediately I numb my pain, and if there is something to help me out, I use it and then I forget it. And she did brilliantly on this remedy. So that's how I've used different ones in this family.